Welcome to our sonography lecture on renal pathology, part 5 of 14, benign renal tumors for the sonographer. This lecture will cover angiomyelopomas, adenomas, oncocytomas, and lipomas. Benign renal tumors are relatively rare, and any solid tumor that we find on the kidney should be treated malignant until proven elsewise. Patients are usually going to be asymptomatic with benign renal tumors, and they will be incidental findings for workups for other symptoms. Flank pain can occur if the mass becomes large enough and starts to hemorrhage. Our first benign tumor that we'll discuss is the renal angiomyelopoma. So breaking down the word angiomyelopoma, angio refers to blood vessels, myo, muscle, and lipoma, fat. So we have a benign tumor that is found in the kidney that is made up of fat, muscle, and blood vessels. This type of tumor is also known as a hamartoma. Renal angiomyelopomas are the most common benign renal tumor. They're more commonly seen in women, and they happen to be highly associated with tuberous sclerosis. On ultrasound, angiomyelopomas, or AMLs, are typically hyperechoic. They're very round in structure and commonly seen in the superior pole on the anterior surface in the cortex. Because we need to treat any solid tumor that we find on the kidney as malignant, CT is actually very good at differentiating angiomyelopomas from a small renal cell carcinoma. Remember that small renal cell carcinomas typically do present as hyperechoic solid tumors. However, they do have increased vascularity where the angiomyelopoma typically does not. So here's an example of an angiomyelopoma. Again, very bright, no shadowing, no vascularity, usually found in the cortex of the kidney. Here's another example of an angiomyelopoma. They usually are relatively obvious, especially when they are surrounded by the more hypoechoic cortex of the kidney. And yet another example in the longitudinal and transverse plane of an angiomyelopoma. The brightness of the angiomyelopoma typically comes from the fat content of the angiomyelopoma, making it isoechoic to the fat that can also be seen surrounding the kidney. Our next benign tumor is the renal adenoma. As we've learned about other adenomas in the body, adenomas are usually slightly atypical to normal cells that make up the organ, just kind of put together in an abnormal way. So we know we can have a hepatic adenoma, we can have thyroid adenomas, and we can have renal adenomas. So again, these are benign renal tumors, typically made of epithelial cells found along the tubules of the kidney. On ultrasound, the renal adenoma is going to appear as a solid mass, typically a little bit more centrally located. It can be echogenic or hyperechoic, and if we put color on, we should not really detect any flow. So here's an example of a little bit more hyperechoic adenoma. We can see the renal parenchyma around, and then we have this brighter hypoechoic area more centrally. You can see from this image that this does appear slightly irregular, and so this would be concerning for malignancy until proven to be a benign adenoma. Our third tumor then is the oncocytoma. The oncocytoma is a solid tumor of the kidney, usually benign. They can turn malignant, but are usually benign, and are typically, again, made of epithelial cells. Now, oncocytomas are going to be more common in men, and they're going to be more common in older men over the age of 50. Oncocytomas take on a very large, heterogeneous appearance within the kidney. What's particular then to oncocytomas is the spoke wheel pattern and the central scar. Now, in this large mass off the kidney, what you'll see is in the center of it, a hypoechoic kind of divot or dent in the center of it. That's the central scar. And that central scar usually represents some sort of blood vessel that's in the center of the oncocytoma. From there, then, you'll see these hypoechoic extensions from that scar going towards the periphery of the tumor, kind of representing that spoke wheel pattern. Those also typically represent some blood vessels, and so we will see increased vascularity on the oncocytoma. Now, what's concerning about oncocytomas is that they are going to look very similar to a large renal cell carcinoma. So again, we cannot prove oncocytoma versus renal cell carcinoma until a biopsy has been made or other imaging that can differentiate the two. So here is our example of an oncocytoma. We have the kidney here in transverse with the sinus here, and then we have this large mass off of the side. In another example, or in a color example here, again we have the kidney off to the side here. Increased vascularity throughout the oncocytoma. There are kind of these spokes of blood vessels coming out with that central scar. Here is another example of the same tumor via CT. So we've got the kidney in transverse here, and then we have the oncocytoma off to the side here. Again, we can kind of see this darker central area with extensions towards the periphery. Our last benign renal tumor that we need to talk about then is the lipoma. Lipomas can be found anywhere within the body. Lipomas are made of fat, so it's a solid tumor made of fat. These are more common in women, and because the tumor is made of fat, we usually will see then that as an echogenic mass within the kidney. So these take on a very similar appearance to the angiomyolopomas. It's important to remember that angiomyolopomas are more common. So if you see a bright echogenic structure within the kidney, you should think angiomyolipoma over just a regular lipoma. However, we cannot differentiate the two on ultrasound until a sample is taken and looked at by histology. And that is the end of benign renal tumors. Up next, we're going to talk about renal diseases.